Good morning. Now, David Rendell announced that he couldn't attend the last Health and Medicines Committee meeting, and he said, would I chair the meeting? And of course I said yes, naturally, assuming that the chairman didn't get to do anything. They just sat there and divvied up the tasks that needed completed amongst all the other attendees. And I thought this sounded a great laugh. And unfortunately, it wasn't until the end of the meeting they said to me, well, you've got to do a video diary of what the committee has achieved. Which is very difficult because, of course, it's a committee, so by definition it has achieved extraordinarily little. So, what have we achieved? Well, one thing we've done a lot of work on is antibiotics and antibiotic usage. And we are, as a committee, quite frustrated about this. We've put a lot of time into it, and we haven't got anything as yet to show the membership. If you look on the literature, there is an extraordinary amount of detail on antibiotic usage in farm animal species. It's published annually under the acronym VARS, the Veterinary Antimicrobial Resistance and Sales Surveillance Report. And they have huge amounts of information about how much antibiotics are used in terms of milligram of antimicrobial per kilogram of livestock. They use what they term a population correction unit, which is the average weight of, say, a pig when it would be treated with antibiotics. And there's nothing like that in equine practice at all. And because of the nature of it, with us using unlicensed drugs and such like, we just don't know what's being used. So we've been working with various practice management system providers to try and get a reliable way of seeing how much antibiotics are being used. Now, if you're using Eclipse, then they have produced that and it's ready to go. And if you want to, please contact Beaver and we will show you how to do that. RoboVet are also, I think, well ahead with the system, and VetIT have also been quite helpful and are making progress with it. So antibiotics is a work in progress. Anthelmintics. David Rendell's done a lot of work on this, and he's been liaising with the VMD. And the latest stage of that is that there are various working parties being established to look at the different aspects of anthelmintic use. And we did identify some volunteers, and also how we were going to find volunteers to go onto these various working parties. We looked at our website, we did review that, and one of the things we came up with was we want to update and add more client information leaflets. These are the little QR codes that you can put on dispensed medication, which will then give clients all the information they need to know, and we're generating some more of those. And James Crabtree is also doing some more frozen semen information leaflets, including about vesicular stomatitis, which apparently is a thing. So, we have a representative on EIDS, that's Equine Infectious Diseases Surveillance, that's Sarah Smith, and she gave us an update on that. And in particular, they're looking at strategic management, strategic approach to infectious diseases management at a local level, and trying to develop perhaps a series of flowcharts about how you should manage infectious disease when it presents to you in the first instance, with a view to limiting spread. That, I'm afraid, was all we've achieved this time. Thank you.